Good afternoon, everybody. Thank you for joining us. I have some very valuable information that I think is essentially and vitally important to hopefully everybody. My name is Shaun Sullivan. I'm a physical therapist, athletic trainer, 33 years of experience of working with patients ages 3 weeks old to 100 years old. I have experience with professional athletes, moms to infants, and all walks of life in between, all kinds of people. I am currently seeing patients in Bay City, on the east side of Bay City, and in our facility in Auburn. So our subject today is called the Triad of Health or Triangle of Health. We use those terms interchangeably, as that's kind of the way I've been educated. And when we talk about the triangle of health, triad of health, think of it as a literal triangle, an isosceles triangle, whatever triangle you want to describe it as. With one edge of the triangle, a nutritional and chemical component, one edge of the triangle being an emotional, mental, and spiritual component, and the other side of the triangle being structural and or physical component to that structure, the structure of the triangle. All vitally important to our health of every person out there. So some of these thoughts will be kind of alternative and kind of new to many people. Although these thoughts were developed by an extremely intellectual person, Dr. George Goodhart, who was a chiropractor in Detroit. And he developed these thoughts back in the 1960s and did much clinical research, physical research. He thought it out very well, and he was very intelligent. And so he promoted this, and I've had the good fortune of studying under 3 of his students in the last 10 to 15 years. So here we go. Our first side of the triangle that we're going to talk about is the nutritional and chemical side. Again, I want to try to paint a big picture with some basic information. The chemical side, the old adage of "you are what you eat" is extremely true. Now, I will add that I am not the picture of all the things that I'm going to say. I'm not a extreme true follower. I do like ice cold Coca-Cola, and I do like sugar. And I do like chocolate. So anyway, I'll get that out of the way. You are what you eat. We've heard this for years. Fruits, vegetables, protein from animal, fish, and plants are basic food sources. As we add caffeine, sugar, processed foods, alcohol, etc., the chemical nature of our body changes. We also have to consider dehydration, viruses, especially at this time, infections, medications, drug interactions, drug toxicity, exposure to chemicals and toxins and molds and heavy metals, and smoking as ways that our body's chemical makeup can and will change. Our immune system, driven by our lymphatic system, which is hopefully going to be my next topic. We're going to talk about the immune system and the lymphatic system at a later date, because basically I'm going to try to hook you in with all the words I'm talking about now into that next webinar, which is going to be equally as important. Anyway, our immune system and our lymphatic system is only as resilient as we make it. And this is so true. Lymphatic system is important, and many of us completely ignore it or treat it extremely poorly. So, as one side of the supporting triangle, our chemical makeup is very important. Questions could and should be directed toward your physician, then a nutritionist, then a pharmacist, then an epidemiologist, then an internal medicine physician, et cetera, et cetera. So I know I'm throwing out information there on all these, the factors of that side of the triangle, okay? And what I want you to take from this is that there are so many influences that we don't realize, we don't understand, we don't think of, but they're out there, okay? And again, I'm trying to build a picture. So one example I have of a nutritional / chemical deficiency, and this is extremely common. It's a vitamin D deficiency. A lot of people talk about it. A lot of people don't understand it and what it can actually mean. And a lot of times it's very underdiagnosed. We live in Michigan. About 6 months out of the year, the sun, which provides most of our vitamin D, is very inefficient for helping us with our vitamin D issues. So we get D from sunlight. Yes, we can get some vitamin D from milk, but it's an inefficient transporter. We get it from egg yolk. We get it from liver. We get it from fish. But the causes or the issues with a vitamin D deficiency, we can get osteoporosis, we can get thyroid issues, we can get muscle and joint pain, which is something that we as physical therapists deal with a lot, obviously. We can also get depression from vitamin D deficiency. A couple of facts about vitamin D. It helps us absorb calcium from our food, which leads back into that osteoporosis, kind of high fracture rates, things like that, what I just spoke of. Sunscreen can decrease our ability to synthesize vitamin D from sunlight by 95%. Now, I'm a extremely fragile skin person, you know, and all my dermatologists say, you got to wear sunscreen, you got to wear sunscreen, you got to wear sunscreen. But at some point you have to weigh the balance of sunscreen versus your vitamin D, et cetera. I won't dive too much more into that. Vitamin D also modulates our cell growth and our immune function. Again, there's that immune system and lymphatic system, which is really important to our general health. Exposure to sunshine indoors through a window does not produce vitamin D. So if we're driving around in our car in December or sitting in our front window facing the west, we're not really absorbing any vitamin D from outside, especially in December or January or February or March. All right, so that takes us to my next slide of, well, actually, I'm going to come back to that slide. I'm going to go to the next angle of our triangle, our mental, emotional, spiritual side that definitely influences our overall well-being. When we talk about mental and emotional stressors and dysfunction, if you will, from birth trauma to current stress levels and everything in between, this is a side of the triangle that may be unknown and or ignored quite highly. Fear, past physical or psychological trauma, grief, loss of a job, loss of a relationship, loss of finances, etc., can manifest into pain at any time. Each one of us has different coping skills, and for many of us, they are tested on a daily basis, especially in the last 6 months. I mean, let's agree that this last 6 months has been extremely stressful on everyone's mental and emotional state with this COVID-19 virus. Physical and mental stress is very detrimental to our overall health. It's well known, and I'm just throwing that out there. Again, mental and physical stress and psychological stress, we need to address those with our physicians, our mental health practitioners, and those professionals that take care of those kind of issues. Unfortunately, on the physical therapy side, yes, we deal with those on a daily basis, but are we trained heavily in that? Not necessarily, but we do recognize it. So it's not that we don't understand a lot of things. Numerous cases of pain in some body parts are solved with counseling and talking out the trauma. Many times, as a medical practitioner, we don't consider mental and emotional side of the triangle. And sometimes we waste precious time and money before we come to a solution of that person's pain. There's a very high-end practitioner down in the Detroit area that has written books on mind-body syndrome. And Dr. Schubner relates the mind-body syndrome as kind of buried trauma, buried physical and emotional trauma that may come out later in life as neck pain. And we as practitioners, we try to treat the neck pain, and it's diagnosed or it's tested with diagnostic testing and et cetera, and it never changes. And someone goes in and they finally start to do some psychological counseling and some good mental emotional counseling, and it's found to be an old stressor or an old trauma that they work through the issues and the neck pain goes away. Now, you can do all kinds of physical therapy for that, but until you address the real issues, that pain is probably going to stay there. So that's one side of the triangle that is very difficult to assess, but it is extremely important, as you can all imagine. All right, now to the last side of the triangle, and kind of my favorite side, obviously, as a structural and physical worker, body worker. So the structural and physical side, lots of people treat this side of the triangle. Physical therapists, chiropractors, athletic trainers, massage therapists, any other body worker that you can think of. And hopefully we all influence it in a positive way. When we speak of structure, we talk about organs, we talk about skin, bone, muscle, tendon, ligament, fascia, connective tissue, etc. Restricted mobility, dysfunctional movement patterns, fractures, tears, strains, sprains, surgeries, trauma are all things that we body workers work on. And that comprises the structural side of the triangle. Now, I have a little quote that is kind of puts this all together. Are your headaches due to your poor diet, your motor vehicle accident from 6 years ago, or the emotional stress of your job? That is a quote that ties together the structural, mental, and chemical nutrition side of the triangle of health. Or are all three combining to cause your issues? Again, that kind of ties it all together. So when we talk about that triangle of health, really the whole person approach, the holistic approach, is obviously the way that we can influence in a extremely strong way all sides of the issue. Because let's face it, I don't, in my 33 years, if I were just to treat the structural aspect of all my clients, my success rates would not be as high as they are while trying to put together the nutritional side and the emotional side. And again, seek out an appropriate healthcare provider if you have questions about any of this and about your health in general. I wanted to go back to this slide where the Triad of Health is inside of another circle, and this was a big work of Dr. Goodhart. So we have the Triangle of Health on the inside, and then we have other influences on the outside of the circle that are really, really important, and not a lot of people talk about them or understand them. We talk about acupuncture meridian channels. There's lots of people out there that use acupuncture. There's lots of people out there that don't believe in acupuncture. I believe in it. I don't use it. I know how to use it. In the state of Michigan, we're not really, as physical therapists, we're not really allowed. So that's that. We can talk about the neurology aspect of it. That's nerves. That's our nervous system. The neurolymphatic system is, again, back to that lymph system, immune system that is a drainage point for many things. We talk about the neurovascular and neuromuscular system, which is the nerves connected to the muscles. And then we talk about cerebrospinal fluid, which is our brain. Remember, brain is master control. If we don't be kind to our brain and cerebrospinal fluid, all these other things don't necessarily matter because they are so intertwined. I'm going to go to, the holistic approach. These are just some of the comments and kind of positive statements that I've had from patients over the years. You can kind of read those. Most unusual therapy experience ever. I hopefully that's a good thing. And then my treatments were never cookie cutter treatments. And that is so true because we change. Every person changes every day. There's no 2 days alike, and there's no two patients alike. Okay, so I'm going to put up our locations. Like I said, I'm seeing patients in Auburn and Bay City East Side. We have 12 other clinics in this area with some great practitioners in each. How about, Kate, do we have any questions? Oh, I had one question that was kind of preloaded, talking about sleep. Sleep can be a very big monster. Sleep tips, starting from, again, nutrition. Are you eating and drinking things late into the evening? Are you eating and drinking things that irritate your gut? Are we sleeping in spaces that are maybe too hot, too cool, too much noise, too much light? Is the mattress so old, broken down, that it's so soft that we are getting no support? Basically, when we talk about mattresses and pillows, we want to kind of be in this neutral body level. We don't want to be up, down. Remember the old water beds that were like unbaffled water beds, and it was like laying on a Ziploc bag full of water. There's a lot of factors with sleep, and I unless they're really specific questions, there are many answers. I know I'm being sort of vague, but those are truth. So anyway.
Great, thanks so much, Shaun.
Okay.
We didn't have any new questions. We just had that one about sleep, so thanks for answering that.
All right.
Other than that, I think we're ready to wrap up.
All right. Again, I thank you for joining us. Hopefully I gave you enough information to be inquisitive, and that's kind of my goal, is to ask questions and think about some of the things that we talked about, and kind of move forward with getting help. So thank you again.
Thanks, Shaun.